Local and systemic reactions. So managing systemic complications. One is fluid overload. Overloading the circulatory system with excessive IV fluids causes increased blood pressure and central venous pressure. Signs and symptoms of fluid overload include moist crackles on auscultation of the lungs, edema, weight gain, dyspnea, and respirations that are shallow and have an increased rate. The treatment for circulatory overload is decreasing the IV rate, monitoring vital signs frequently, assessing breath sounds, and placing the patient in a high Fowler's position. Air embolism. The risk of air embolism is rare, but ever present. It is most often associated with cannulation of central veins. Manifestations of air embolisms include dyspnea, incyanosis, hypotension, weak rapid pulse, loss of consciousness, and chest, shoulder, and low back pain. Treatment calls for immediately clamping the cannula, placing the patient on the left side in the Trendelenburg position, assessing vital signs and breath sounds, and administering oxygen. Air embolism can be prevented by filling all tubing completely with solution and using an air detection alarm on an IV pump. Complications of air embolism include shock and death. Septicemia and other infection. Pyrogenic substances in either the infusion solution or the IV administration set can induce a febrile reaction and septicemia. Signs and symptoms include an abrupt temperature elevation shortly after the infusion is started, backache, headache, increased pulse and respiratory rate, nausea and vomiting, diarrhea, chills and shaking, and general malaise. In severe septicemia, vascular collapse and septic shock may occur. Causes of septicemia include contamination of the IV product or break in aseptic technique, especially in immunocompromised patients. Treatment is symptomatic and includes culturing of the IV cannula, tubing, or solution is suspect, and establishing a new IV site for medication or fluid administration. Prevention includes careful hand hygiene. Number 1, hand hygiene. Examination of the IV containers for cracks, leaks, and cloudiness, anything that doesn't look right. Using strict aseptic technique, replacing the peripheral IV cannula every 48 to 72 hours or as indicated, replacing the IV cannula inserted during emergency conditions with questionable asepsis as soon as possible. Using an air eliminating and bacteria particulate retentive filter with non-lipid containing solutions that require filtration. You want to replace the solution bag and administration set in accordance with agency policy and procedure. Infusing or discarding medication or solution within 24 hours of its addition to an administration set. Changing primary and secondary continuous administration sets every 72 hours or immediately if contamination is suspected. Changing a primary intermittent administration sets every 24 hours or immediately if contamination is suspected. If in doubt, toss it. Managing local complications. Now we've talked about those. Phlebitis, thrombophlebitis, hematoma, and clotting of the needle is something we will discuss a little bit more now. So infiltration, extravasation. We talked about infiltration as the unintentional administration of a non-vesicant solution or medication into surrounding tissue. This can occur when the IV cannula dislodges or perforates the wall of the vein. Infiltration is characterized by edema around the insertion site, leakage of IV fluid from the insertion site, discomfort and coolness in the area of infiltration, and a significant decrease in the flow rate. And you'll actually see the fluid leaking out around the IV tegaderm. When the solution is particularly irritating, sloughing of tissue may result. Closely monitoring the insertion site is necessary to detect infiltration before it becomes severe. I've actually seen where skin has been just eaten away by that because nobody's watched and observed the patient. A warm compress may be applied to the site if small volumes of non-caustic solution have infiltrated over a long time, and the affected extremity should be elevated to promote the absorption of fluid. So phlebitis is defined as inflammation of a vein related to chemical or mechanical irritation or both. It is characterized by red and deformed area around the insertion site or along the path of the vein. There's pain and tenderness at the site or along the vein. Treatment consists of discontinuing the IV and restarting it in another site and applying a warm, moist compress to the affected site. Phlebitis can be prevented by using aseptic technique during insertion, using the appropriate size cannula or needle for the vein. Thrombophlebitis refers to the presence of a clot plus inflammation in the vein. It is evidenced by localized pain, redness, warmth, and swelling around the insertion site or along the path of the vein. Immobility of the extremity because of the discomfort, and swelling, sluggish flow rate, fever, malaise, and leukocytosis. Treatment includes discontinuing the IV fusion, applying a cold compress first to decrease the flow of blood and increase platelet aggregation, following by a warm compress, elevating the extremity, and restarting the line in the opposite extremity. Hematoma results when blood leaks into tissues surrounding the IV insertion site. It's a bruise. We've all seen it. Sometimes they can be really bad, and sometimes they can be minor, but nevertheless, it's a hematoma. So the leakage can result from perforation on the opposite vein wall during venipuncture, the needle slipping out of the vein, and insufficient pressure applied to the site after removing the needle or cannula. The signs of a hematoma include ecchymosis, immediate swelling at the site, and leakage of blood at the site. Treatment includes removing the needle or cannula and applying pressure with a sterile dressing. Applying ice for 24 hours to the site to avoid extension of the hematoma, and then a warm compress to increase absorption of the blood. Assessing the site and restarting the line in another extremity if indicated. A hematoma can be carefully prevented by inserting the needle and using diligent care when a patient has a bleeding disorder, takes anticoagulant medication, or has an advanced liver disease.